Hi, my name is Iliamari, and I have struggled with postpartum anxiety and depression. I have two children, a 5-year-old and a 1.5-year-old. With my 5-year-old, when he was born, he was actually born a premature baby at 27.5 weeks. We were in the NICU for almost 2 months until his official due date, a few weeks before his official due date. And during the NICU time, and even after when we were at home, I struggled a lot with anxiety, mostly postpartum anxiety, a few times with postpartum depression, but mostly anxiety with my first child. I questioned everything that I did. I questioned if I was being a good mom, if I was taking care of my baby the right way. I was always worried about what could happen with him, especially because he was born premature. I wasn't sure, what the right thing to do was with my first child. With my second child, she was born at 37.5 weeks. We planned her C-section. I also have fibroids, so we were dealing with that during her pregnancy. So she was born at 37 weeks, planned C-section, and with her, I struggled mostly with the depressive symptoms and some rage as well. The two pregnancies were a little bit different. The two deliveries were different. So I definitely experienced more of the postpartum depression with my second child. Always sad about not connecting with her the right way, not doing the things the right way, not more anxious, but more sad that I couldn't necessarily connect with her, or was I doing a good job as a mom. And some rage as well, because I also had an older child. I was losing my patience a lot more with my children. I was losing my patience with my husband, my support system. I was just getting, bothered and annoyed at the littlest things, and I just felt internally that rage of, out of control feelings is the best way I can put it. With both pregnancies and after delivery, I did seek help. I started working with my counselor initially 5 years ago when I was experiencing anxiety. And then now with my second child, I still see the same counselor. It was very important for me to be more proactive the second time around. So I still continue to meet with a therapist to make sure that if any anxious or depressive thoughts come in, that I am able to handle them in the best way possible. And there's nothing wrong with seeking help and maybe problem solving or talking through whatever is going on. Thank you for joining.